Welcome to my channel. My name is John, and you're with me at Elton's Retirement Journey and Travels. And a special welcome to all my new subscribers. I want to wish you a Merry Christmas and a Happy Holidays. In this video is titled ACA: The Good, the Bad, and the No Longer. So I recently retired from Morgan Stanley September 26th, and I am taking the ACA. I got it full coverage on a Browns plan, and that was for November and December. I had a physical, as well as I've got my meds uh, supply to get me into next year, a 30-day supply, and I have some left over. So let's go ahead and get into the video here. The Affordable Care Act, or Obamacare, was signed into law by President Obama on March 23rd, 2010. Typical high deductible plans, bronze, silver, and a gold. And they had recently changed the law. You can have a health savings account if you're signed up with a bronze plan, which I do. It has various deductibles, premium costs, visits related to the copay, and the different percentages of your explanation of benefits. Our typical coverage was once you paid your deductible, a couple grand, um, the maximum out of pocket, then it would be covered at 100%. Prior to that, you would have coverage of 80% where you would pay 20%. It's a little bit different now. It's typically used as uh, catastrophic insurance with the high deductibles and the high out of pocket max. So if you had a heart attack, a stroke, or some type of cancer or something, you would need to have about 10 or more $1,000 on hand because you're going to be responsible for that. But it is good coverage. So let's cover some of the things. Now, I spoke to my doctor about this, and he wasn't too happy about it. He had a lot of bad things to say about it, and specifically because there are 10 things that must be covered, and he felt that it should be a little bit different for a male versus a female. So your ambulatory patient service, outpatient care without a hospital admission, they have coverage for that. That may be require you have a specialist copay. Your emergency services care for sudden severe illness or injuries, that's covered. Hospitalization, inpatient care, including surgery and overnight stays. Pregnancy, maternity, and newborn care. So this is going to be for the women, but they made it so that this had to be in there. Then you're going to go back and you're going to have some, you're going to have the mental illness. You have mental illness, mental health, and substance abuse. You're going to have prescription drug plan, and you're going to have rehab and habitability services. I believe that's going to be people coming into your home, and your laboratory services, blood tests, and other work covered, and preventive and wellness services, chronic disease management. So your screenings, vaccination, and ongoing care. And there's some pediatric services if you have kids, so your kids will get some coverage. So that's it in a nutshell. What they wanted to do was make healthcare obtainable for all Americans, regardless of what your political affiliation is. And it also would have helped out people who are independent contractors, like your truck drivers. A lot of those guys have their own rigs. They travel on their own. They're on the road by themselves. They would be able to get in here and purchase a policy and then possibly write it off as an expense on their taxes, as well as someone who will be a homemaker, the husband carry the insurance, he passes away, or there's some kind of divorce, and the head of household doesn't have coverage. They can go on a state Medicaid type coverage, or they can purchase their own. And let's talk about some of the key requirements. Now, the biggest one here is no pre-existing conditions. Insurers can't deny coverage or charge more due to past health issues. This is critical. A lot of us have ailments that run in our family, could be diabetes, cancers like prostate cancer in my family. I had been uh, experiencing some high blood pressure. I take some medications. Now that I'm retired, my blood pressure is way down. So I'm going to be talking to them and try and get off some of those medications. So that's a big thing. I have gotten stuck with pre-existing conditions before this was law. I had worked at a as a contractor at Home Depot. I signed up for a bronze paneling, and it was $38 was coming out of my check, and I think I got paid every 2 weeks or something. So I went and got a full physical. It was one of the best physicals I ever had, and they didn't cover it. They said, "Hey, look, your screenings are not covered, and you fill this form out saying that you had been diagnosed with diabetes or high blood pressure, and they did not pay any of the lab work." I got stuck with $1,000 bill from LabCorp, and it was not negotiated prices. These were the full prices. So if you think that that's something that you can live without, you're wrong. Dependent coverage, young adults can stay on a parent's plan until age 26. There's employer mandate. Larger employers, 50 plus, must offer affordable minimum coverage. And they removed the penalty. They had a penalty if you didn't have coverage. I know that I get a statement every year from the Morgan Stanley, the 6 years and 5 months I worked there, and it would have X's in every month that I had coverage. Continuing on here, so we have a on my plan that I have is with Oscar Healthcare of Georgia. So I was able to get a physical exam. I had an upper respiratory infection, and I did what's called a virtual urgent care, where I talked to them. I said, "Hey, I get this every year, and here's some notes on what I had prescribed previously." And they went ahead and called the prescriptions in for me. There was no charge. And a week later, I was feeling a whole lot better. The upper respiratory infection must have been bacterial because it was causing me to have a shortness of breath. I don't think I was getting enough oxygen. But anyway, that is an example of how you would utilize it. And that worked out very well for me. And of course, I went and got the screening. And so that's in process. And I've got the lab work back. I think I'm going to owe $70 on that. Um, so that's some of the good things about it. My prescriptions got filled, and it came in right on budget at about $29. I got the whole regimen of medicine to cover me for 90 days going into 2026, just in case um, the Healthcare Act or whatever it's going to replace hasn't been implemented that I can take advantage of. So for me, retiring early, I now have what I call catastrophic insurance in case anything happens. Um, Before I retired, I made sure that I got the dental work done. I got two crowns done. I had some inflammation in my foot, and it looks like there may be uh, some kind of elevated acid that's causing me to have some type of gout or something. But I have to follow up on that. So we got that test taken care of. Then, of course, as you get older, you got to get all these other screenings done. But that's what the ACA allowed us to do in the fire movement, financial independence, retire early to get some type of coverage. That is the good part about it. Now, the bad part about it is, like my doctor was saying, he doesn't like it because, for a male, we would like to pull out a couple things and add a couple things in or something like that, is what he was saying. But he's getting paid from this, so I don't know what the big deal is. But he went on and on and on and on. But now that I'm utilizing it, and so many of us are utilizing it, it is not bad insurance to um, have coverage on, especially if you got $10,000 sitting around to cover your out of pocket expenses. Um, my coverage is 50% after the maximum out of pocket. So if I had $100,000 uh, heart condition or something like that, I would be on the hook for quite a bit of money. But I have that money available and I could pay it, which is good. And most of us who are receiving ACA are like that. We retired early and we factored in the out of pocket deductibles and what our portion would be. So it's not like we're ripping off the government or anything. Actually, it is one of the best benefits that has ever been presented to the average working class person, with so many people losing their jobs. Um, you know, so that is the good part of the ACA. Now, the bad part about it, if I'll continue on with that, is that originally you had two things that people didn't like. Number one, there was pushback from the insurance companies where families, through their corporations, they had to pay additional amounts that they had not had to pay before. And that typically was like $300. So if you're a family of four and this program is implemented and the insurance companies push back, and then you have open enrollment, and now it's going to cost you $300 more out of your take home pay. That's like reaching in your wallet and taking three $100 bills out. And a lot of people absolutely hated Obama and this whole healthcare thing because of that. And so that's the bad part. And I've talked to a lot of people, and some of them didn't even make sense. Well, what about the pre-existing condition? Well, just pay out of pocket. Really? Um, the other thing is there was a mandate where if you did not have healthcare coverage of any kind, that you would be penalized with some penalty on your taxes. They eventually got rid of that. And the rest of it could have been just bigotry or hatred towards Obama because of his color, skin color. It could have been just racism. But for those of us who are retiring, this has been a very, very good program for us. The next 10 years is going to cost $350 billion for 10 years. So that's the cost. That's three aircraft carriers would be what they would spend the money on if they canceled it. And they're guaranteed that the big Gerald Ford class aircraft carriers. Once you outfit them, it's 120 billion. So if they order three of those, there's your funding for the Obamacare. Um, so that's a big negative on that. Right now, a lot of people in certain states are seeing that their premiums for next year are going up to what it was when they had Cobra. Now, my subsidy is $1,136. The plan that I picked for next year has a subsidy of $1,336. They have allowed me to enroll in it for next year at a zero cost. The same plan that I'm already on, if I chose that one, I would have a premium of $8. The zero plan has a higher deductible and a higher out of pocket maximum. And then their cost sharing is going to be 50%. I will be 64 in the early part of 2026. I must last, as of today, a total of about 14 months. And then I go on Medicare, and then this problem goes away. But for the rest of the folks who are in the fire movement or will be joining the fire movement, not having access to the ACA is going to be a real problem for them. They'll just have to pay out of pocket with it no longer being available. Now, on this Saturday, as I record this before it gets dark, um, Congress and Senate, they're going home for the holidays. You're not going to see them until next year. So it looks like this is going to be expiring. The Republicans never did put together any true plan. What they say is we want to do a voucher system where we will give or assign amount to the insurance companies or the participant, which would be me or you, a certain set amount to cover your health care. Something like that, you want to watch that because it is a voucher program. Every year they can just vote to fund it less, making cuts. So if you're getting $1,100 now, well, just say $1,300 to cover my insurance. It could be go down to like 900 the next year, then from 900 to 700, then from 700 to 500. The Republicans, all they've ever said is that we will not remove the um, pre-existing conditions. It will always stay. But they never put together a comprehensive plan that we replace it. I don't know if they have been bringing in the medical leadership as well as the insurance companies to redo a new plan that they can get passed through that would meet um, everybody's needs across both parties. So it looks like they're just going to go on vacation. It's going to expire, meaning it's no longer going to be available. And that's not a good deal for a lot of us who may be finding ourselves losing our jobs with no option to go back to work, where we're going to be forced into retirement. So I wanted to bring this on. I am using it. I've always supported it. I thought it was a good deal. Um, After Obama got reelected the second time, that secured it, and that's why we've had it for 15 years. The other thing is that John McCain got hospitalized. When he came out with that brain cancer, he decided not to vote against it. So they weren't able to repeal it and get rid of it. So it has survived. And for a lot of us who are retiring, it has been that last little piece that makes it okay for you to go ahead and retire. This is something that you do want to have around for your population. There's a lot of other countries that have this, and it is a program that does work despite what a lot of people say about it. So this is my presentation on the ACA, the good, the bad, and the ugly, and the no longer having it. So I'm going to go ahead and end this presentation. And if you got any comments, please leave them. And if you would kindly subscribe and give me some likes on the video. We are closing out this year, and I've already been getting distributions from my investments, which we're all going to summarize um, going into the first of next year, and we're going to fund next year as well. I've got some other interesting topics that I'm going to be covering over at the Retiring Club. I just recently sold some shares in one of my investments. Is a good thing I did because the capital gains that paid out weren't even close to the $1,000 that I sold and put in my cash reserves. So this is John, and you're with me at Elton's Retirement Journey and Travel, the host of the Retiring Club, ACA, the good, the bad, and the no longer. Thanks for watching, and make it a good day.